Welcome to Season 1, Episode 6 of the Home Healthcare Today show. We have the pleasure and honor during this episode to visit with Authority Health. Authority Health has been around since 2005, providing full-scale healthcare services to Metro Detroiters. So from pediatrics all the way to senior care. April is known and noted for National Minority Health Month and also Alcohol Awareness Month. So during this episode, we are going to sit with the CEO of Authority Health, Miss Loretta Bush. In the second segment of this episode, we will visit and have great dialogue with Dr. Hussein Sighar. But for starters, Miss Loretta Bush, current CEO of Authority Health, has been in this position since 2019. Prior to being appointed CEO of Authority Health, she was the CEO of Michigan Primary Care Association. Also, Ms. Bush brings multiple years of experience as an executive and a community advocate for public health. She served as group executive and health officer for the Detroit Department of Health and Wellness Promotion and the Department of Health Services and director of public health for the Wayne County Public Health Department. Mrs. Bush is a graduate of University of Michigan. She holds a undergraduate degree in sociology. She also has a master's degree in health service administration from Central Michigan University. Mrs. Loretta Bush, thank you for joining us today.
Thank you so much for having me.
Yes. Loretta, you've done so much in your career in the public health space. Mm-hmm. So let's elaborate just a little bit. Talk to us about your passion for Wayne County, your passion for Detroiters, and public health here in this area.
Yes. So I'm a native Detroiter, born and raised in Detroit, a product of Detroit Public Schools.
Awesome.
And again, then went to Michigan schools for both undergraduate and graduate. So Michigan has been my passion, and particularly Southeast Michigan.
Yes.
My passion for health really started early, because even with my undergraduate degree in sociology, I really focused on medical sociology, because I wanted to have a keen awareness of how people viewed health, how they approached health systems, what motivated them to feel comfortable seeking health care, and those things that were barriers to that. So my mother would say that I got that passion early on, because unfortunately my mother suffered an illness. Good news is she survived it, but she was very sick when I was young. Mm-hmm. And watching that later on in my life, she said, that's why you wanted to always help, and you wanted to go into public health, and you wanted to teach people what preventative health care was, and how they could stay healthy throughout the lifespan.
Yes, ma'am.
Yeah.
Very
and
good.
then, Detroit and Wayne County has some very special issues, right?
Certainly, it does.
Because then we get into the social determinants of health. We get into so much of the negative, but there's also so much strength here in Wayne County, so much strength in Southeast Michigan. And the good thing about population health, we not only focus on the disparities and all the things that are going haywire, but we're also taught how to really focus on the assets in a community, right?
Absolutely.
How to listen. Mm-hmm. The importance that the teacher becomes the learner, right?
Yes.
When you're talking to a client, a patient, if you listen, they'll tell you their troubles, but they'll also tell you their dreams. They'll give you the clues that you need to support them in helping themselves, right?
Absolutely.
And that's the absolute beauty of population health.
Yes, it is, Loretta. Yeah. Thank you so much, Loretta. And it is very, very inspiring, the fact that you are a native of Detroit.
I am.
And you chose to impart legacy. impart your leadership here in the community, right? Where you have a choice to be anywhere, but you chose to be here. And we are so appreciative of that here in Metro Detroit. As we think about Authority Health and its founding, right? Back in 2003, at that time it was Governor Granholm that really honed in on those social determinants of health that greatly impacted Metro Detroiters. And then for those listeners as well as viewers, when we talk social determinants of health, we do talk about access to healthcare, quality healthcare,
Of course.
access to education. We talk about economics, right, and some of those gaps, as well as communities and then households within communities. So with that piece on social determinants of health and the history, what would you consider to be the vision as well as the mission of Authority Health, Loretta?
Absolutely. I'm so glad you're giving me the opportunity to say that.
Yes, ma'am.
Because we have a bold vision, but
Yes.
it's one that we truly believe we can one day see. And that is, our vision is all people living healthy lives in healthy communities. And we know that not all health will look alike, right?
Right.
We all have different abilities. Some people will live with asthma.
Sure.
Some people will live with a physical disability. But that ability to live your best life,
Yes.
depending on your set of circumstances. And then when we talk about healthy communities, that's what really excites me.
Yes.
Because there's been a body of work that has shown that your zip code can be a better predictor of how soon you will die
Yes.
than your genetics. So your zip code is a better predictor than your genetic code.
Right.
And that should not be, right?
No,
Whether
it should not
we're
be.
in this zip code or another zip code, we should be able to live our best life based on our set of health and genetics and all of that. And even that can be impacted, right? I know
sure
we're the
could.
product of mom and dad and everything.
Yes.
But if we know, the cards that we've been dealt, we can
Yes.
better play them.
Absolutely.
So
Yes.
whereas somebody else may be able to eat a little more or exercise a little less, knowing my genetics may mean that I may go to be very moderate on some things and very heavy on some other lifestyle changes.
Absolutely,
So,
Loretta.
and an organization such as ours really believes that all people can live healthy lives in healthy communities. We understand that there are some barriers that people face in certain communities that aren't in other communities, but we
Yes.
want to identify those. We want to understand those.
Yes.
And then we want to work with the partners to help us to assist people in living their best life. One of the things that we have definitely found is that the total interaction is not just between patient and physician. And I know you're going to talk to our wonderful Dr. Sighar in a moment.
Yes.
And but we respect the care team. So we know that it takes sometimes the community health worker, the social worker, the nurse, and then we also extend ourselves outside of our clinic walls. And so we interact with people who work with employment, or how to get one's children back, or how to get a GED,
Yes.
or job seeking, because all of these things impact,
They do.
how you're going to be healthy and how you'll live healthy in healthy communities.
Yes, Loretta, and you gave so many invaluable pearls of wisdom in your response to that last question. And some of the ones that really stand out to me as we talk about zip codes
Yes.
being a predictor or somewhat of a determinant of one's mortality, right, versus one's genetics. And we know in genetics there's some things that we can modify. What I am so encouraged about in your response, Authority Health is modifying the communities and modifying the population in which individuals of various zip codes reside and how they live and what they have access to, which is so encouraging and incredible, right? As you modify the community here on the east side, also the location on Broadway, and then the pediatric center in Southfield, right?
Yeah.
Indeed. So with those locations, what are some of the ways that Authority Health has been able to positively impact stakeholders at various levels.
There is a program that I really want to share with you
Please.
and the viewers, because we're very proud of all the work that we do. But I just want to focus in on right now diabetes and obesity and BMI, right?
Yes.
So what we've been able to do here at the Papa Family Health Center in partnership with others, we identify patients that have a certain BMI and also have certain chronic conditions like diabetes or hypertension.
Yes.
And then our physicians, now get this, write a prescription for fresh fruits and vegetables,
Wonderful.
right?
Yes.
But we don't stop there. Then we give them a voucher, and in partnership with the farmer's market, they can then go cash in that voucher to actually purchase these fresh fruits and vegetables. And then prior to COVID, it had to be, kind of suspended a little bit, but we're going to gear back up. We also would give little cards that had menus on how to cook these healthy foods. And right in our parking lot, not this last summer, but the summer before, we had 3 fabulous chefs out there teaching this community, the 214, how to prepare fresh fruits and vegetables in ways that are fantastic and contribute to a better BMI and reduces hypertension and doesn't aggravate their diabetes. Because let's face it, food is supposed to be a wonderful experience.
Sure.
If it doesn't taste good, if I don't like it, you can tell me how good it is for me, and I'm just not going to eat it.
Absolutely.
But if you write the prescription, we respect, what medical professionals tell us for the most part. And I know ours are very well trained, but also very compassionate. So when they write that script, but you also get the voucher, and then you also have a place that will accept it and buy it, and then we're also going to tell you how to cook it in ways that sometimes are familiar, but sometimes are new. Right?
Absolutely.
It's like, I remember, our parents would always say, you got to try it 3 times before you really don't like it, right? Before you really don't like it.
Okra and rutabaga.
Absolutely. And you mentioned the one. I'm still trying to develop a relationship with rutabaga.
Well, you got to put some syrup on them, and then you'll think they're sweet
on
potatoes.
The rutabaga? Okay.
Put some syrup on them.
Now, when I became an adult, me and okra are fast friends. I had it last night. It's amazing that you would mention that. Yeah, me and okra, but I didn't like, everything's about the visual though too, right? And so
stringy, the little white seeds in there.
Yeah, but you know what? But there's ways, and that you can cook it that it has less fluid on it.
That's
so
right.
To speak.
That's right. That's right.
So it makes it more edible, and chopping it up.
See.
Yeah, the chop sometimes is more amenable than when it's full.
That's it.
And just like the kind of conversation that we're having right now, isn't that how talking to people about health and how to stay healthy and food? That's right, because if it's real, stiff and serious, and you've got to eat this so you don't die and everything, that's not the way we think about food.
No,
we think about, most people are very passionate about food, how they eat it and what they eat and all of that. So that's why I'm very... and that program is called Fresh RX.
Fresh RX.
Yeah, and we operate that out of Papa Family Health Center in partnership with the Farmers Market, and there's also another partner that right now is escaping me, but the point I'm trying to make is that we don't try to do these things alone. Not when you want to create healthy communities. You have to find like minds out in the community. During COVID, there was a church here on the east side that called us up and said, do you have some patients that could benefit from food boxes? Well, of course we have patients that could benefit from food boxes. And then in turn, we say, do you have some parishioners that could benefit from COVID testing? And now, do you have some patients that could benefit from COVID vaccine? Awesome. So it all comes full circle. It's definitely get to know your neighbor, utilize it, work hand in hand to create healthy communities.
Absolutely, Loretta. And in view of the Fresh RX and the food choices, right? And it's interesting how Authority Health has been able to bridge that gap between individuals getting access to fresh food and nutrition versus some of the local convenience stores that we see in our communities, right? So we're at times inundated with convenience stores that don't necessarily offer the best choices or access to fresh food.
Right.
And with that being said, with the convenience stores, there's also alcohol that is sold
Yes.
in those venues, and this is Alcohol Awareness Month. So we're looking at ways to mitigate, obviously, mitigate the challenges that are presented by abuse of alcohol and overconsumption,
Yes.
as well as the bad habits that come by way of just bad diet via communities or convenience stores and the like. So great work there. And we're also pleased to learn of the partnerships.
Yes.
Which takes me to my next question,
Okay.
where people are going to hear us talking Loretta, and they're going to say, I want to get in on that, especially the okra and the black eyed peas conversation. they're going to
Absolutely.
they're going to want to get in on that.
And those two go very well together,
I'm
don't
trying
they?
to tell
and
you.
both of them are very healthy for you.
With a little vinegar as well, right? So just do it and do it right.
Yes.
Yes.
Just don't put that, the fat back and
See.
and the ham hocks and
No,
stuff
don't do
in
that.
the beans.
Don't do it.
Because we know that smoked turkey flavors those beans very, very
That's
well.
it,
do we
right?
not? So
And pepper. Pepper is
You're
good,
making me
right?
hungry.
We're going to get it in. We're going to have to get it in. No doubt about it. Yes, ma'am. Loretta, how can additional partners assist you and your team and the board here at Authority Health in fulfilling that wonderful vision that you have for Detroiters?
Yeah, so the patients many times need help with things like transportation. They need help with, again, getting a GED or completing high school, job training. Literacy is a huge thing. We have
Yes.
another program that we're very proud of, and that's where our resident physicians were doing wash and learn. So they would set up in laundromats and teach health education right in the laundromat. See, these are the things
Clever.
that bring a
Very
smile
clever.
to my face. You
Yes.
take it to people
Yep.
in the places and in the way they can learn it. So health literacy is also a big one. So partnerships like that. Also, some unlikely partners, but they are indeed partners. Jail. Sometimes
Yes.
people realize when they're in jail that their drinking or their use of drugs
Yes.
has gotten them in trouble.
True. True.
That stay can be an eye opener.
Certainly.
And we, love those referrals because
Yes.
we have the medication assisted therapy, which helps people to be free of their drug and alcohol addiction. And I know there's gonna be more conversation about
Yes, ma'am.
that. But so we look at almost every entity as a potential partner.
Yes.
If you touch the lives of human beings.
Yes.
In positive ways, you can be a partner with us.
Wonderful.
Because that's what it takes to have healthy communities. It's really everybody working together. And, it's my belief that everything should be looked at through a health lens.
Yes.
Absolutely everything. I don't care if it's voter registration, because I always tell people, sick and dying people don't go out to vote.
No.
They're home being sick and dying.
True.
So there's the health lens.
Yes.
So if you want people to be able to go out and march or vote
Yes.
or speak out, these are people who are usually healthy. And when I say healthy,
Sure.
whether you're going in a wheelchair to vote or whether or not you're walking or whether or not you're doing that with assistance. So as healthy as you can be.
Absolutely.
Being able to then go out and do certain other things. So when I look at it, when I look at education,
Yes.
sick children have a hard time learning.
True.
If you can barely breathe because you're asthmatic, you're going to spend a lot of time at home or in the hospital. But if we can control your asthma, then you're not going to miss all of those days of school.
That's right.
If you're sick, it's hard for you to concentrate on the ABCs and trigonometry and all
Absolutely.
of that. So let's get your health needs under control. If you're hungry and you don't have enough to eat, that's gonna impact your health.
Yes.
I could go on and on.
It's there.
Everything.
It's
I
there.
believe that everything should be looked at through a health lens. And probably what happened in Flint is the biggest example. Look at everything from a health lens. If we change this, and what
True.
is going to be the health impact? And saying looking at things from a health impact does not mean that we're doing it as a attempt to stop that from moving forward.
No. Right.
But we want to prevent some trouble.
We want to prevent it.
Right?
Absolutely.
There was a study that showed, it was in another state, they were because they looked at it through a health lens, they were about to end one of the bus lines. They looked at it through a health lens, and they realized if they stopped that bus line, that was a major bus line to a medical center and some other very critical health services. Fortunately, that municipality decided not to stop that bus line, right?
Yes.
So I could go on and on,
No, Loretta,
looking at things from a health lens.
Loretta, you're spot on. You're spot on. Our missions align in that respect. I've come to find also how important health is in various work that we do as a home health care provider, where we do attempt to focus on health education and focus on wellness, to that job development piece that you gave. The fastest growing jobs are in the healthcare sector,
For sure.
as well as technology. So really honing in on how to develop healthier individuals and healthier communities is the key, right? We've heard it said more often than not that health, or true wealth, is health. And
That's right.
We thoroughly get that and understand it. Loretta, last question for you. Are there any upcoming opportunities of immediacy that our listeners, viewers, various stakeholders can join in to assist or contribute to Authority Health?
Well, I think I would be remiss if I didn't talk about COVID and COVID vaccine.
That's right.
Particularly in relationship to this being Minority Health Month,
Yes,
where
ma'am.
the theme is vaccine ready.
Yes.
And so all of your listeners should be thinking about how they can get vaccinated, how they can encourage their friends and families. Maybe you need to pick them up. Maybe you need to make those calls. All of that. That's probably the area at which we all need to focus on, because probably everybody, or at least most of us, want to get to that new normal. And I didn't say get back to normal, because
a new normal.
it's a new normal. But we will get to our new normal quicker when we recognize that it needs to be all hands on deck when it comes to vaccine ready. And not only in our communities, but in all communities. We want to not spread bad information or disinformation.
That's right.
We want to steer people towards good information and where they can go to get vaccinated, because that is, I don't think anyone would question that that's truly a public health crisis right now.
Yes,
and if we want to be able to stimulate the economy, get our kids back to in-class learning, get them back to playing organized sports, if that's your thing. And I know the value of organized sports because it teaches teamwork and all of that kind of thing. So all of these things, if we want to do that, let's just be vaccine ready, as the theme of Minority Health is. Vaccine ready.
That's right.
For your listeners. Let's be vaccine ready. Let's step up. If we could get just lots of healthy communities with a lot of sore arms.
Indeed. That's right. Initially.
That's right.
It wears off.
It wears off. It wears off, right? So I think that's the biggest thing. If I can only say one parting thing, let's be vaccine ready, and then we can move on, and we can continue to deal with the other health issues at hand: asthma, diabetes, hypertension, and all of these things. It's not hopeless.
No, it's not.
It's not hopeless. We really can live healthy in healthy communities.
Absolutely.
We just have to know how and be consistent with it.
Indeed.
Yes.
Thank you so much, Loretta. Congratulations once again on your appointment to CEO of Authority Health. You are the authority, if you don't mind us giving you that tag.
Oh, I'll take it.
Yes. It's our goal at American Advantage Home Care, through the Home Health Care Today show, to perhaps be the authority on home health care.
And you are.
If we could, thank you. So we could share that mantle together.
That's right.
And on that last call for action for vaccines, Here at the Pop-Off Center,
Yeah,
vaccinations are taking place, right?
they are taking place.
Yes, and at your other two locations.
Not there yet.
Okay.
Not there yet. Just we're doing vaccinations here at the Pop-Off Family Health Center.
Wonderful, wonderful. Thank you so much.
You are welcome.
Spring is a beautiful time in Detroit and Southeast Michigan. American Advantage Home Care brings that energy, joy, and vitality of the season right into your home, coupled with skilled home health care services. Our world-class team of clinicians can help you to thrive, maintain, and rebound in the comfort of your own home. Finding a home health care agency more compassionate and caring than American Advantage Home Care is a long shot. Welcome back to Season 1, Episode 6 of the Home Health Care Today show. As you all know, April is National Minority Health Month as well as Alcohol Awareness Month. And we've had the delight to visit with Authority Health today at their Pop-Off Center location on Mack Avenue on Detroit's east side. In our first segment, we sat down with the CEO, Ms. Loretta Bush, and got a plethora of knowledge and wisdom as related to Authority Health, its services, her passion, as well as vision for this amazing healthcare facility. As we transition to part 2 of our segment, we are here with a clinician, Dr. Hussein Sighar. Dr. Hussein is a board-certified family and sports medicine physician. He is a graduate of Michigan State University, and he also holds a Master's of Science in Public Health. He's been practicing for 9 years, and he is a lead physician here at the Pop-Off Center. Welcome, Dr. Sighar.
Thanks for having me.
Dr. Sighar, you could practice wherever you like or wherever you very well choose. Talk to us a little bit about why here in Detroit and what's your passion? What's your passion for this community as well as public health?
Well, that's a really good question. You know, one of the things that this goes back to is I was born and raised in Southeast Michigan.
Yes, sir.
So my parents are immigrants.
Yes.
So, you know, I've always appreciated the diversity of Southeast Michigan.
Yes.
What it's done for me, what it's done for my family, and who it's made me as a person.
Yes.
And so when I was doing my training, I was trained at the Detroit Medical Center. I did my internship there and my fellowship. And then I went to actually Flint to do some of my training as well.
Awesome.
And, you know, one of the things that we brought up earlier was the Flint water crisis.
Yes.
So I was actually in my training when I was during the water crisis.
Yes.
And so one of the big things I realized is just how much government policy and things that we actually don't even perceive as healthcare related issues
Yes.
can impact the health of our population.
Mm-hmm.
And so that always followed me,
Yes.
you know, and it really made me want to have I think a bigger impact on the healthcare system.
Wonderful.
And the social determinants of health.
Yes.
So one of the things that I did was I actually took a break from practice,
Okay.
and I actually applied for a program called the Commonwealth Fund Fellowship in Minority Health Policy at Harvard University. And so during that year, I basically spent time with leaders from across the country on how to impact change and enact health equity. I got my MPH, Master's of Public Health and Health Policy and Health Management.
Yes.
And, you know, I can't think of a better marriage between healthcare and public health
Yes.
than an organization like Authority Health.
Absolutely.
And so in my role here, I've been empowered by our CEO, Mrs. Loretta Bush, to not only be the program director of a family medicine residency
Yes.
and train 18 family medicine residents,
Wonderful.
but also, you know, really have an impact on what we do as an organization.
Yes.
And so it's been, I think, a dream job for me.
Mm-hmm.
And, you know, it's really allowed me to really better our community here in East Detroit.
That's good. That is good news. Good news, Dr. Sighar. And as we dovetail to our previous segment with Mrs. Loretta Bush, we all share that commonality of being Southeast Michiganders, you know, the whole Detroit, Wayne County upbringing.
Mm-hmm.
You both mentioned Flint, which is personal to my heart, being an alum of GMI, Kettering University, and spending 5 years, you know, there as a student and now living in Genesee County and commuted into Wayne County out of choice, right? So I think the focus on choice, the focus on communities where we can indeed positively impact individuals is a great call. It's a great calling,
Certainly.
and then answering to the calling is even better. Right. And as we think about that calling for National Minority Health Month, right, and alcohol awareness, there's a lot of statistics out here in public health as related to minorities, right, and minority population. And a lot of those stats are often daunting. In view of that, let's dive a little deeper, Doc, into some of those clinical related issues as related to minority populations and then mitigating those social determinants of health. We do not, by any means, want to ever endure another health crisis such as the Flint water crisis at all. So, Doc, could we dig a little deep into some of those social determinants?
Absolutely. So one of the things that we think about when we see our patients is, are they actually able to come to our clinic?
Yes.
You know, are they able to come to our clinic on certain days of the week? One of the biggest things that we've actually done is we've opened up telemedicine days.
Yes.
So one day a week, we actually schedule patients so that they could actually have access to a physician, even if they don't have, access to a car that day or transportation. Another example of that is what we've done in terms of, medication-assisted treatment that Ms. Loretta Bush brought up a little earlier. I think there's been a huge emphasis on the suburban scourge of opioid use disorder and alcohol use disorder.
Yep.
But, we basically have overlooked it in our cities.
Yes.
And so we're basically saying here at Authority Health, this still exists in Wayne County, but in the city of Detroit, and we're doing something about it.
Yes.
And so another thing that I'm very passionate about is substance use disorder, because we believe it's a disease of despair. It's one of these things that is, a lot of communities have found a lot of shame in, but we're saying there's nothing to be ashamed about. Let us help you get treatment. And I think, going back to, your opening about Flint, well, one of the things that we're trying to be proactive about here at Authority Health is encouraging vaccination. So, we know what the statistics look like. I mean, Detroit was disproportionately impacted by the COVID-19 pandemic. And so to mitigate that, what better way than to roll out the vaccine in one of the zip codes that's most in need of it. And so, we believe in bringing healthcare right to the patient. And I think it fits right in with home health as well. I think that's something that, all too often we don't necessarily think about, but should think about more frequently when it comes to our patients who are in need.
Yes, sir. Yes, sir, Dr. Sighar. And it's interesting you mentioned the zip codes here in 48214. And when patients are discharged from hospitals, right, one of the first things we actually see next to name and diagnoses is the zip code, right? And you have discharge planners that say, do you cover the area? And as a home health care agency, we gladly cover this zip and the surrounding zip codes, Doctor. With that being said, let's view the lens of ecosystems. So we talk about suburbs to an extent, and we do see a great deal of resources or a number of resources readily accessible to individuals. How can we talk more futuristically as well as present tense about developing an ecosystem of health and wellness that eliminates the crutch of alcohol as well as promotes health and wellness for minority populations?
I think one of the biggest things it starts off with is, are you approaching things in a multimodal, coordinated way? For example, coming to a clinic is just a piece of getting to wellness, right?
Yes.
One of the things that I really like about our practice is that we've actually married any type of visit, around substance use disorder to a visit with our therapist, our psychologist, and then we have a medical social worker. And so, getting an entire team involved in the care of a patient and not just letting, healthcare end as soon as a patient leaves our office, our clinic doors. And so I think understanding that it's a structural issue,
Yes.
and targeting healthcare is more of a process than say, hey, a pill.
Yep.
And so that's another great, I think, benefit to being part of a public health organization that also, focuses on healthcare, delivers, clinical care to patients.
That's right.
And so I really love the way you brought that up because, there's absolutely no way we can just end, the discussion, let the discussion end as soon as the patient leaves the clinic.
No.
And so a multimodal approach, a coordinated approach, and a systemic approach is the only way.
Yes, doctor. And there's the why behind the what. So even in our earlier conversation with Loretta about children in households who perhaps aren't as healthy, right? Or having a parent that is ill or a grandparent that is ill, that's going to impact outcomes as related to a student's attendance, their participation, their readiness, and ultimately later in life to an extent with completion, high school completion,
Absolutely.
let alone moving further into the skilled trades and college and the like. With that being a focal point, you mentioned multimodal and then opportunities to engage more with home health care, home health, as well as hospice to an extent for end of life. Some minority populations, right, are more averse to home health care, right, where they say the mode is I'll go to the doctor or the doctor will call me or you're really hooking me up with telehealth now. I'm on my phone. But a therapist coming in to do exercise with me or a nurse coming in to check my vitals, I don't know about that. So, doctor, how would you suggest encouraging minority patients and populations to consider home health care as an option as part of that multimodal approach to healthcare and wellness?
Certainly. And I think once education is factored into this,
Yes.
and cultural competence and an understanding of, hey, you're from, this is a patient that's from, East Detroit where our clinic is.
Yep.
Hey, we understand this patient and they're going to feel more comfortable, speaking to us as a result. I think the other thing is providing excellent services.
Yes.
So one of the things that we pride ourselves on is trying to deliver state-of-the-art care and regardless of the expense to our patients.
Yes.
Just as an example, so as a sports medicine physician, I specialize in ultrasound guided procedures. We purchase ultrasound units and we
Yes.
deliver point of care ultrasound right when patients come into our clinics.
Yes.
And so I think providing an excellent product, a product that is culturally competent,
Yes.
I think the rest naturally will follow.
That's it.
And so I love the way that you really kind of broke it down to, why should we trust you?
Yes.
I think ultimately it comes to a question of why should we trust you?
Absolutely.
And I think it's about building that trust. And it starts with cultural competence.
Yes, yeah, and that cultural competence and that emotional intelligence that comes along with providing care in the community changes the conversation from I feel sorry for you versus I feel you, right?
Exactly.
I am here for you, I am with you, and this is how we're going to do it together. For those patients that are seeking support, seeking medical assistance, I know we got a phone number, right? 1-313-824-1000. Once again, that's 313-824-1000. That is the number to reach out to any of the 3 Authority Health locations. So, Doc, are there any other resources? As we talk, about access to food, that was so great what Authority is doing and giving folks vouchers and training and education on healthier food choices. Any other resources that you would suggest for viewers and listeners?
What I would suggest to users and listeners is reaching out to us as a resource.
Yes.
And if we don't already have a relationship, or a specific resource we can direct them to, let us help you facilitate. Let us be the facilitator. Let us build those new relationships. And I think that is really what we pride ourselves on doing. And so we're going to keep on working on this, and we're going to keep on growing and, speaking to the needs of our patients in whatever way is necessary.
Awesome, doctor. And for some of our homebound patients who do not have a primary care physician, I'm going to kindly recommend them to you, Dr. Sighar.
Thank you.
Yes, sir. Thank you so much for your time today, doctor.
My pleasure. Thanks for having me.
Our pleasure.